This is a special report.
Have a capacity of about 250 people. You put the four together, that's 1,000 people. That is being done on the main showroom floor above us. The construction will start this week. We'll hope to have the construction done in about a week to 10 days and have that capacity set up. Besides those 1,000 units, which are designed to provide a backfill for the hospitals. So to free beds in the hospitals, we'll be using these 1,000 emergency. If we can construct an additional 1,000 beds for medical care, but a lighter level of medical care than most hospitals. So we could get a 2,000 bed capacity in this facility. And as you know, for us, a major thrust is increasing hospital capacity. We're trying to reduce the rate of the spread of the virus, but at the same time, we have to get that hospital capacity up, and we have to get the equipment that we have up. Each of the 250-bed facilities is about 40,000 square feet. There'll be about 320 federal staff that come to work in those four hospitals where they'll take care of about 1,000 people. So all systems are go here. As you can see behind me, the material has already started to arrive. We'll start erecting the equipment upstairs. Luckily, Javits has plenty of space. We're even expanding Javits. This was never an anticipated use, but you do what you have to do. That's the New York way. That's the American way. And we're going to get this done. Again, I want to thank the Army Corps of Engineers for everything they've done and will do. I want to thank the National Guard, and I want to thank all the employees of the Javits Center who are here doing above and beyond duty. So I want to thank them all very much. Any questions? Zach, the tax deadline for the state was extended when the federal government extended the filing deadline. We travel with, if you will, the federal tax deadline. So when the federal government postponed filings, they also postponed our tax revenue. So I'm sorry, one more time. Look, one of the necessary but very difficult byproducts of all of this has been what it's done to the economy. And basically shutting down the economy where we only have essential workers who are now showing up, who keep society functioning, food delivery, pharmacy delivery, et cetera, transportation services. That comes at a tremendous cost. I understand that. And I understand that many people aren't earning an income, and that's put an additional stress on them and their families. Sometimes in these positions, you have to make difficult decisions, and this was a difficult decision. But my adage in these disasters, emergencies, has always been do everything you can, prepare for the worst, hope for the best. This is a public health emergency. This is a matter of life and death. The economy we can fix. You know, the old expression, a rich person is a person who has their health. Anything else you can remedy. You can't remedy a loss of your health. You can't remedy loss of life. And that has to be the first priority. We have to deal with this public health crisis, and then we have to get the economy back up and running. I understand that. The federal government understands that also. The state government is not in a position to provide income to everyone who's not working. State government is also suffering from a revenue loss. Federal government suggests that they're going to pass legislation quickly to get money into the hands of unemployed people. I'm pushing very hard to get the federal government to do exactly that. But first order of business is deal with this virus and this health crisis. This is going to get much worse before it gets better. We are still in the relative calm before the storm. You're going to see the number of infections, the number of cases increase dramatically. You are going to see an overcapacity of our health system. Right now, we're projecting, you'll see more people coming into the health system than we can handle. And that is, to me, the #1 priority for government, for society. Once we get through that, we'll focus like a laser on the economy. We're even planning now, what do we do about the economy? But first order of business is we have to do everything we can to save lives, literally, and that's focusing on the healthcare system. I'm sorry, Shimon. Well, days from now, by any of the projection, we can handle the rate days from now. The immediate problem in New York City were the supplies, the masks, the gowns, etc. We've been working very hard to find and buy supplies all across the globe. I believe we have enough capacity for the entire state, including New York City, for the immediate future. But the main issue is we have 53,000 hospital beds. We are projecting a possible need of 110,000 beds. I've ordered today the hospitals that they must increase their capacity by 50%. If that all works, that takes us from 50,000 to about 75,000 beds. We still have a possible need of 110,000 beds, so we're not there on the beds. I'm less worried about the beds themselves. I'm more worried about the equipment, because many of these acute cases are going to need ventilators. And we need about 30,000 ventilators, and we can just not get them. And that's where we're going to need the federal government to step in and step up. I have said I think the federal government should use what's called the Federal Defense Procurement Act, where the president says to specific companies, I need you to produce this equipment, I need it now, here's the date, here's the numbers I need. Relying on voluntarism of corporations is great. And American corporations have stepped up to the plate. New York corporations have stepped up to the plate. But we can't manage this operation on an ad hoc basis of voluntarism by corporations. We should be ordering the specific equipment that we need and ordering corporations to produce it to the volume that we need. That is our limiting factor. Yes, we need hospital beds. Yes, we need staff. But most of all, we need the equipment. I'm sorry. Where do you go? We have hospitals that are operating in New York City. All hospitals have now been ordered to increase their capacity a minimum of 50%. I've asked them to try to find a way to increase their capacity 100%, right? We have 53,000 beds. If everybody increased it to 100%, you'd be at roughly the 110,000 goal. I don't believe it's reasonable or feasible to tell every hospital you have to double the goal, so we set a minimum of 50%. Those hospitals that are first over capacity, this will be a backfill facility where we can relieve some of the pressure and the tension from hospitals by using these beds. It is as serious as a matter of life and death. My advice would be act sooner and act more dramatically. Don't procrastinate. There'll be some people who say, oh, this is too dire. We don't want this level of disruption. It's not going to be that bad. This is media hype. They are wrong. They are wrong. We have enough supplies in-house today to make sure all health staff across the state have the right equipment. And again, we have been scrambling. We're buying from China. We're buying from all across the world. Can I say that we'll have enough equipment for next week, the week after? I can't say that. And that's out of our control, and that's where we need the federal government. Look, everyone has to do what they have to do. The states are in a position to manage certain activities. But the federal government has a set of capacities that we don't have in the state. I'm one of the senior governors in the United States. I know what a state can do. I was also in the federal government. I was a cabinet secretary. I did disasters and emergencies as a cabinet secretary. I know the capacity of the federal government. They have more capacity than the state. When it comes to securing medical equipment, ventilators, masks, gloves, they are in a much better position to do it. They legally have a tool called the Federal Defense Production Act. Use it. Have the materials made. To have states competing with other states to find these equipment, frankly, bidding against other states, driving the price up. Masks that we paid 85 cents for, we're now paying $7. Why? Because California is bidding, and Illinois is bidding, and Texas is bidding, and Florida is bidding. It makes no sense. The federal government must nationalize the equipment production and supply issue. First, we're getting the existing medical staff all the equipment that they need. We have all the equipment they need. I can't promise what happens in the future if the federal government doesn't step up and actually do the production and supply. We also are setting up for reserve medical personnel. I'm contacting all the retired nurses, all retired doctors. I'm asking medical schools to make their staff available, nursing schools to make their staff available. We're also contacting all registered healthcare professionals across the state, over 600,000, to ask them to be ready to come in as a reserve staff. Yes, we have translation services on all the state information services, the websites, etc. And I want everyone to know in the state of New York, We are a family in New York, and we're working together, and we're caring for each other, and everyone in the family gets treated the same.
All right, thanks, everybody.
Yeah, the city, I spoke to Mayor de Blasio, I spoke to Speaker Corey Johnson. I asked for the plan. I want the plan today. I want to be able to approve it. I want it on paper, Zach, and then I want to be able to use it for the entire region, because I've seen this before. If you try to do something in just New York City, people are smart. You know, New York City residents, I'm a New York City boy, you make a rule, we'll figure a way around it if we can, right? So you can't have a rule that pushes people from New York City to Nassau or to Westchester or to Suffolk. We've seen that before. We've seen that during Superstorm Sandy with the gas prices, where New York City set one set of rules to buy gasoline. All it did was drive everyone from New York City to Nassau and to Westchester. So whatever we do with a geographic area that makes sure that people actually comply. I have to get back to work, guys. Thank you very much. Thank you. Thank you.